Director of Ceremonies, Ms. Dudu Manenga, Permanent Secretary in the Ministry of Public Service, Labor and Social Welfare, and Chairman of the Working Party of Senior Officials on Drug and Substance Abuse, Mr. Simon Masanga, Permanent Secretary in the Ministry of Information and Broadcasting Services, Mr. Nick Mangwana, Secretary for Provincial Affairs and Devolution for Harare Metropolitan Province, Mr. Tafadza Muguti, senior government officials here present, representatives of the World Health Organization and other United Nations agencies, captains of industries, representatives of civil society organizations here present, Acting Director of the Zimbabwe Youth Council, Mr. Brian Magwande, officials from our social partner, Pamumvuri, invited guests, ladies and gentlemen. It is a great honor and privilege for me to address you this morning as we gather for a breakfast meeting hosted by Pamumvuri under the theme Consolidating Efforts in Tackling the Drug and Alcohol Misuse Menace in Zimbabwe. The aim of our meeting today is to have a conversation around the programming that we should collectively undertake under the auspices of the Interministerial Task Force on Drug and Substance Abuse. At the global level, the Sustainable Development Goals of the United Nations, or Agenda 2030, provides a framework within which member states can develop national programming that promote the development of their economies and advance the well-being of their people. In particular, SDG number 3 on ensuring health, lives, and promoting well-being for all, and the National Development Strategy of Zimbabwe, NDS1, provide the government of Zimbabwe with the necessary framework for the establishment of the National Interministerial Task Force on Drug and Substance Abuse, which was formed on September 14, 2021. From the onset, allow me to commend the various government departments, development partners, civil society players, and the private sector who have lined up initiatives towards responding to drug and substance abuse that will run nationwide, targeting young people, the youth, and the general populace. The coming together of these organizations should reshape and restore the worth and dignity of our communities. We should therefore unite in fighting the drug and substance abuse menace that has become topical in our country. It is in coming together that we find sustainable solutions that will help us to rid society of these challenges and make it clean again. In essence, therefore, all stakeholders should complement each other in reaching out to the furthest areas of our society. We need to ensure that no area and no person is left behind as far as cleaning up our society and making sure that we have healthy lifestyles is concerned. We need to work collectively and avoid duplication of interventions. Hence, a whole of community approach should be encouraged. In this way, we should edge closer to attaining our National Vision 2030, which says towards an empowered and prosperous upper middle income society by 2030. Director of Ceremonies, how we are going to achieve the national vision is not fathomable in the case where our youngsters in the community are victims of drug and substance abuse. Therefore, we need to take concrete steps to address the level at which the children and youth in the country are consuming dangerous drugs and illicit substances. Drug and substance abuse has become a cause of serious concern and is now threatening the pride of the country, and it is negatively affecting our socio-economic development and prosperity. As you might be aware, ladies and gentlemen, globally, drug and substance abuse is associated with high crime rates, mental health problems, high incidence of HIV and AIDS, failure to contain pandemics like COVID-19, sexual abuse, terrorism, human trafficking, school dropout, and child marriages, among many other vices. Looking closely into our Zimbabwean society, we are also not spared of these challenges, given that the level of drug and substance abuse has now reached alarming levels and now require unconditional dedication, hard work, and above all, teamwork for all relevant stakeholders. In this regard, we need to contextualize the African Ubuntu model, which says, you are because we are. I am because we are. And that it takes a community to raise a child. And therefore, we need to work together in solving these problems so that we ensure that we have a healthy and productive, youthful Zimbabwean population. The response to drug and substance abuse is not the responsibility of one ministry or one individual or one organization. Cabinet agreed that the response towards drug and substance abuse requires a multi-sectoral approach in order for the survivors to get comprehensive services and not leave anyone behind. We have divided ourselves into the following 5 pillars. The supply reduction pillar, chaired by national security. The demand reduction pillar, chaired by the Minister of Youth, Sports, Arts and Recreation. The harm reduction pillar, chaired by the Minister of Health and Child Care. Treatment and rehabilitation pillar, chaired by the Minister of Health and Child Care. And the community reintegration pillar, chaired by the Minister of Public Service, Labor and Social Welfare. Let me hasten to emphasize that all these pillars, even though led by government agencies and ministries, need the collaboration and participation of the private sector and of civil society so that we can provide a very comprehensive approach to solving this issue. I encourage you all to apprise each other with work plans in order to avoid duplication of services in some areas and omission of services in other areas. Most importantly, ladies and gentlemen, when responding to drug and substance abuse, humanity should be at the core of what we do. We have to lead by example and be guided by fundamental principles of confidentiality and ensure that adequate protection of everyone, especially children, is at the center of what we do. This calls for a controlled emotional involvement, non-judgment attitude, as well as client self-determination. What is also important is to strengthen the referral pathway by knowing who is doing what and where in our areas of operations so as to make sure that survivors receive comprehensive services. We as government are taking stock of the facilities that are available for purposes of rehabilitation as well as reintegration into society so that we can bring these services to optimality. As I conclude my remarks here today, Director of Ceremonies, I wish to encourage all players in the Interministerial Task Force as well as our partners on drug and substance abuse to be guided by the terms of reference that establish the task force. I wish to end by thanking you all for the zeal that you continuously demonstrate in crafting solutions to help the country to respond to the menace of drug and substance challenges in our communities. I want to give a special mention to Pamumvuri for taking the initiative to organize this event and bringing all of us together in order to share ideas as well as apprise each other as to where we are with the work of the task force. And on a day-to-day basis, let's be seized with this matter so that we can make a dent to this menace that is affecting our communities. Let me end by saying, may the Almighty God bless you all, and may ye indeed bless our beautiful country, Zimbabwe. I thank you.